So Robert F. Kennedy Jr. is, well, definitely a familiar name in American politics. He's the son of Robert F. Kennedy, the former Attorney General and presidential candidate. And beyond that, he's also known for his years of work as an environmental lawyer. In late 2024, he took on a surprising new role, Secretary of Health and Human Services. Yeah, President Donald Trump appointed him to the position, and honestly, that decision caught a lot of people off guard. I mean, Kennedy had just challenged President Biden in the Democratic primary only months earlier. Then he went on to launch an independent presidential campaign with the slogan, "Heal the Nation." Kennedy's campaign really focused on a few key themes. He promised to address chronic diseases, wanted to reform the food industry, and pledged to investigate the causes of autism. His appointment to HHS gave him, well, a real platform to act on these issues. But it also, thrust him right into the center of several major public health debates. Kennedy's time as secretary has been marked by bold actions. And yeah, a fair bit of controversy. He's overhauled vaccine policy, taken aim at processed foods and chemical additives, and he's clashed with career scientists and public health experts. Now Kennedy's supporters, they see him as a champion for change. They believe he's finally addressing issues that have long been ignored by the political establishment. But his critics, on the other hand, well, they're worried. They question his understanding of science and public health, and they're concerned about the direction he's taking. As Secretary of Health and Human Services, Kennedy didn't waste any time. He moved quickly to push his agenda forward. One of his first big moves? He ordered the department to prioritize finding the cause of autism. He also launched something called the Make America Healthy Again initiative. And yeah, that's a pretty bold name. This program focuses on preventing chronic diseases like obesity and diabetes, and it promotes healthier eating habits across the board. Now, Kennedy has been a vocal critic of vaccines for years. He believes they might be linked to autism, a view that, it's important to note, is not supported by scientific evidence. Still, Kennedy has doubled down. He's called for more research into vaccine safety and has even slowed down the approval process for new vaccines. One of his most controversial decisions? That would be ordering the CDC to withdraw its recommendation for fluoridated water. He argued that fluoride is a neurotoxin and claimed it poses risks to children's health. This move sparked strong opposition from dentists and public health organizations who pointed to decades of research showing fluoride's benefits in preventing tooth decay. Kennedy also made big changes to leadership within key HHS agencies. He fired several top scientists and vaccine regulators, replacing them with people who share his views. That led to accusations that he was politicizing science. Critics started to worry, and loudly, that these changes could weaken the government's ability to protect public health. So, while Kennedy has definitely faced some serious pushback in Washington, he's also found support in other places. He's made a real effort to reach out to communities that, honestly, often feel ignored by the federal government. He's traveled to Native American reservations and rural areas, meeting with folks who are struggling with health problems and, more importantly, listening to their concerns. His Heal the Nation bus tour took him all across the country. He spoke at town halls and community centers, emphasizing his commitment to environmental justice and health freedom. He argued that everyone, no matter where they live, deserves access to clean water, healthy food, and affordable health care. One of his most high-profile stops was at the Navajo Nation. He met with tribal leaders and community members there. They discussed the long history of environmental contamination on native lands and the serious health problems many Native Americans face as a result. Kennedy pledged to work with the Navajo Nation to help address those issues. But despite his efforts to connect with everyday Americans, Kennedy remains a pretty polarizing figure. His views on vaccines have alienated a lot of scientists and public health experts. His management of HHS has drawn criticism from both inside and outside the government. And some folks are starting to wonder whether he's more focused on promoting his personal beliefs than on, following the science. Robert F. Kennedy Jr.'s time as Secretary of Health and Human Services has, well, been anything but quiet. He's taken on powerful interests, challenged conventional wisdom, and sparked some pretty heated debates about the role of science in government. His legacy? Yeah, it's still being written. Some people see him as a visionary leader, someone who's asking the tough questions about our food system, our environment, and our health. Others, though, view him as a dangerous demagogue. They're worried he's undermining public trust in science and the institutions meant to protect it. Only time will tell how Kennedy's actions will ultimately be judged. But one thing's for sure, he's definitely left his mark on American health policy. His tenure has been filled with both progress and setbacks. He's raised awareness of important issues, sure, but he's also deepened divisions in an already polarized society. Whether he'll be remembered as a force for good or ill, well, that remains to be seen.